What's going on, everybody? Welcome into another episode of the Strength for Your Purpose podcast. Hope you all had a fantastic week. I know I did. I hope you really enjoyed this string of interviews we've had going on here too, because it's really kicked off the year strong here, and a lot of really good inspirational stuff, a lot of really good informational stuff. These guests have really been bringing a lot of passion, and I expect nothing less today. No pressure, Lauren. But I am so pleased today. This should have been done months ago, but I am so excited to introduce you all to the newest member of the Work Fit Me team. And that's physical therapist Lauren St. Pierre, who has not only her doctorate of physical therapy as I do, but also she is a board-certified geriatric specialist. So really excited to introduce you all to her today. Lauren, thanks for taking your time out of your evening to chat with me on this.
Thanks for having me.
Of course. And I was actually thinking about this before we started the episode today. There's probably one or two questions that even I haven't really asked you yet about kind of how you got going and how the geriatric thing came along. I know we obviously had conversations about that as we were talking about working together. But there's probably a few parts of this that maybe that I'm really excited to learn about, because maybe I don't know about it yet. So really excited to learn more. So the first thing right out of the gate here is talk to us a little bit about how you got interested in physical therapy in the first place.
So I actually was in high school and I was a big dancer. So ballet, tap, jazz, hip hop, modern, I did it all. And I did some summer programs, and I took a injury prevention course from the physical therapist for the Boston Ballet. And I thought she had the coolest job. So I knew I wanted to do something medical. So I kind of just latched on to physical therapist when I was looking at colleges, and I got into an entry-level program, and it just really worked out. I might not have known a lot about physical therapy when I started the program, but it fit. So I just stuck with it, and it worked. Mm-hmm.
Yeah. That's a cool experience, because I always tell when people ask me that question, I go, well, if you had 10 of us in a room, 9 of us would probably tell you we had PT once, and that's how we wound up here. So that's a cool experience that it was still related to something you did as a kid, but it wasn't because you necessarily needed to utilize it. You just thought like, wow, this is a cool extension of my sort of passion for helping people via the medical field and my other passion of dance.
Yeah. I don't think I've ever been in formal PT.
Yeah.
For myself, besides, treating myself and having my fellow colleagues work with me. But yeah, I didn't have any injury in high school. I guess that was the point of the course, right? She wanted to make sure us as dancers knew exactly how to keep ourselves strong. So I appreciated her perspective and her passion on making sure we didn't get injured.
Yeah, that's fantastic. And I think we'll dive into that a little bit more here as we go in the conversation. But talk to me a little bit about your sort of evolution of, because as we said, you're a board certified geriatric specialist. There are probably some people in that age group or that population group that dance, right? So it's not
I had one today.
Yeah, exactly. Yeah. So it's not like you made a full pivot away from that, but that group of individuals that you're really passionate about helping isn't necessarily in the Boston Ballet either. So talk to me a little bit about that transition of like coming out of school or entering school with that passion, coming out of school, what you did and what sort of led you to become more passionate about helping people age a little more gracefully and in place with that much more independence.
Sure. So my first job was outpatient ortho, and I was working with the younger population, mostly a handful of, older people that would come into the clinic, but definitely like high level athletes and, people who are really active and young and have like, the ACL tear or the tendonitis and things like that. But my first job just, it kind of was great for the year and a half I was there. And then my husband and I decided to do travel PT. And once I did travel PT, I worked up in northern Maine. I worked in Arizona. I worked on the coast of Oregon. And a lot of the jobs that you get with travel PT tend to be home care or skilled.
Mm.
And I just found that I really liked it. And I met some wonderful, wonderful people. And sometimes with travel jobs, you get put in these rural communities that don't have a lot of resources.
Mm.
So I was seeing these clients, you know, I maybe only would see 3 a day because I was driving an hour and a half between them, that just didn't have that many resources at their fingertips, but they needed care. So, you know, I had to be really creative, and I had to really advocate for them and look for the closest resource. And it just sparked a passion in me that, you know, these people should be getting the care that they need, regardless of where they live.
Mm.
And, you know, just that they deserve to age without pain and suffering, and be in these beautiful rural communities and live the way they want to live. You know, why would you retire to a rustic county where there's minimal services? Well, it's gorgeous.
Yeah.
And people want to do that. So let's empower them to be able to do that.
Mm. Yeah.
So that's kind of how I got more interested in geriatrics. And then when I came back to Maine, I did, again, work out of Bangor in home care. And I just had more and more of those situations. And that just really, I got more educated in it, and I saw people thrive and really appreciate the support. And it just kind of snowballed from there.
Yeah. That's fantastic. And I'm guessing some of that sort of passion for, again, the creativity and the extra you had to do, because in those situations, I personally, in a professional manner, have never been in those situations with people that I was helping, but the creativity went well beyond what the average or quote unquote normal scope of what we do is defined as, right? Like you were doing, you were doing a lot more than being a PT for these people.
Oh yeah. I mean, and you were getting them back to doing things that like you wouldn't even necessarily imagine. I mean, I was on the coast of Oregon, and you know, you think Maine men have, you know, stubborn streaks, just go out to Oregon. You know, I had a gentleman whose shoulder wasn't even attached. It was in 2 pieces, and he was trying to build stairs from his cabin down to the dock. So, you know, I had to, you know, make sure he was safe, but still help him find creative ways to live the lifestyle he wanted to live.
Mm. Yeah.
Because I think that's important. I don't think we should necessarily have to, you know, retire and be sedentary, right? If there's a safe way to do it, let's find it.
Right. No, I absolutely love that. And you and I have talked about this a ton, but this is kind of where that whole sort of fire for prevention, you know, that you were very, very luckily exposed to at a very young age, because there are not a lot of people, especially dancers. You dancers are crazy. I tell the dancers I work with this all the time. You know this. Dancers are crazy. So the fact that even as a crazy dancer, you were exposed to that idea of prevention at a young age carried you into that, your career, you know, that those transitions of your career. And you know, you're doing even more of that now, but the idea of helping people that are going through that aging process in that 65 plus part of their life, not only can they live the life they want to live, but they should be able to. That idea kind of goes against the grain a little bit of our traditional medical model, because I don't know about you, but I've heard many people tell me straight up that a lot of doctors and specialists and other healthcare professionals they work with just say, well, that just is what it is. And, you know, there's really not much we can do about it, which infuriates me.
Oh yeah. Oh yeah.
But you know, you've kind of infused those two passions, and you're using it even more now as your career continues.
Yeah. I mean, I have patients that tell me, well, old people just fall. That's just what we do. I'm like, well, no. You can stay on your feet. You can still be active and stay on your feet. We just might have to work on a few things and tweak a few things, you know, and like, oh, well, I'm just always going to have this dizziness, so I'm not going to look left for the rest of my life. I have had people that have not looked left for 20 years. And that just, you know, it makes me so angry and sad for them, because there are things that can be done. You know, sometimes, you know, people are in situations where, it might be out of our control. But a lot of times there are things that we can do either to modify your environment or modify something that you're doing or work on certain things that,
Mm.
allow you to turn left.
Yeah.
As simply as that. Yeah. Yeah, but it's definitely, aging has this, I don't know what it's going to hurt. It's going to slow me
Mhm.
down.
Yeah.
It's going to be boring. I'm going to sit and watch TV. I
Mm.
don't want to get old, but we can look forward to every part of our life, I think. I
Mm.
don't think we have to, look at each decade as saying, oh, this is the last decade I'm going to be able to do this.
Mm. Yeah. It
So,
definitely carries some sort of stigma of, you
mhm,
know, an increase in age equals a decrease in, or equals a decline in our drive and our ability and our livelihood. Um,
mhm.
Now, with that being said, it does take a little work though, right? Like we
Oh
can't
yeah. Yeah.
we can't just get older and it'll just be fine, right? There's a little
No.
there is probably a little work involved.
Oh, absolutely. I mean, and I think there's also work that you can do early on, like in that prevention model, that wellness model that, that we love to work in, educating people now on how to, prevent some of the ailments that can be associated with aging. And oh yeah. And I always like to tell my patients, like, I'm a guide, right? I'm not here to fix you. I'm here to help guide you and empower you to do things. But yes, there is work that has to get put in. But it should be enjoyable work, and it should be work that you feel good about doing because we're working on your personal goal. We're not working on my goal or some idealized thing. We're going to take something concrete. We're going to talk about A, B, and C steps to get you to that personal goal of yours. So,
Mhm.
it should be more motivating sometimes.
Yeah,
Yeah,
sometimes.
sometimes.
Sure.
Yeah.
How many how many or how much of the things that you help people with, again, in that age group that you've been really passionate about working with and been, gone as far as getting an entire higher level certification to help these
Mhm.
people, how much of those things that you help those people with could have been at least prevented to a certain degree, maybe not fully prevented, if they had maybe started working on those things in, like, let's say their 40s or 50s?
Oh, that's a tricky question because I could give you a really high number, I
Yeah.
think. I don't want to say everything because obviously life throws us curveballs, but
Mm.
I definitely think that there are things that are given band-aids earlier in life that
Mm.
the band-aid just helps fix the pain or the problem at that time, but you're not actually getting to the root cause of it. And then that kind of snowballs and leads on to, more disability as we get older. But oh yeah, there are so many things.
Mm.
I
Yeah.
mean, I don't even, let me, if you want to, like, a real example, I always like to use the example of like ankle sprains, right?
Mm.
So like when you're 6, you roll your ankle and you pop right back up, right? And you can do that, for the next 10 years. You roll your ankle, it's like, oh, you walk on it a few steps and you pop right back up. You roll your ankle when you're 34 and you're in a boot for 3 weeks.
Yeah.
It's because every time your body had that little injury, it healed, but it compensated just a little bit,
Mm.
right? So if we recognize those compensations and try to correct them before things start to pile up, then we may not get to that boot per se. And yeah, I definitely think 40s, 50s, 60s. I mean, it's never too early or late to start looking at those things.
Yeah.
Am I making sense to you?
Yeah, 100%. And no, you hit the nail on the head there for sure. And I think the other aspect of that, there's some of this aspect of, oh, it's always gone away, so it'll go away again. But
Mm-hmm.
the
Oh
one
yeah.
thing that I like to say is there's going to be there's going to be a moment, and you're not going to know it until you're in it, where the pain's going to come and it's not going to go.
Mm-hmm.
And then all of a
Mm-hmm.
sudden it's been 3 months, and now that okay, now the alarm bells are going off and there's a problem. So yeah, intervening a little earlier. But I love what you said. It's never too late, but it's also never too soon. So just
Mm-hmm.
because you're in that space where it's been 3, 4, 6 months, a year, whatever it's been, if certain things you've done have helped it, but it just hasn't quite gone away, there's still something that can be done. So
Oh yeah, there's
yeah.
so many tools in the toolbox. And I think sometimes too, if people have had an experience with anything like a therapist, a chiropractor, and acupuncturist, and it didn't work for them, it doesn't mean that it won't work this time if it's a different set of tools. And I think as therapists, what really makes us stand out is we have this toolbox, right? And we're going to try the things that we think are going to work best for you. And if they don't end up working best, we're going to adjust and pull from our other, from everything else that's in our toolbox. So even if you think, oh, well, it went away with this last time, I'm going to do X, Y, and Z, and it doesn't go away, or I tried that already, it didn't work. That's not always necessarily the case. And I have to do that a lot, with the population that I work with, just because they probably have tried a lot of different things. So that's another piece where that creativity comes in. And, and I'm not there to give them the same thing. If it didn't work, we're going to tweak it. We're going to try to find something else.
Yeah, that's fantastic. And I think to that point, like you said, some of that population that you work with maybe have gotten care from, and not just from our field, but from other areas of medicine. And those areas look a little different now than they did maybe.
Oh, absolutely.
Maybe five,
that's another great point.
Even as soon as 5 or 10 years ago, the things that we're doing to help certain conditions with certain people pretty much everything has changed a lot, even in just the past 5 or 10 years. And if the last time they had contact with someone in, again, our field or any field was 15 or 20 years ago, things better look a lot different. If they don't, there's some problems, but they should look a lot different too. So that's another aspect, especially if it's something that people have been dealing with for a really, really long time.
Yeah.
Well, great. What are some of the things that you're sort of excited about through the rest of your career here? What are like maybe some like professional goals you have that will help you sort of fulfill more of this passion of helping people just live the way that they want to live, regardless of their age or their past history of physical injury or ailments?
Sure. So, in my population that I really love to work with, there's also often these chronic ailments as well. So you have new conditions, you have chronic ailments, chronic diseases, things that, will not go away, Parkinson's and Alzheimer's, MS and things like that. And I really want to help try to break this cycle that seems to develop in our current healthcare model where, someone gets sepsis and ends up in the hospital and they get deconditioned and then they go home and they have a little bit of therapy and then they have a little bit of therapy more and then they're at a good level. So therapy discharges and then they go about their day and then they get sick again, and every 3-6 months they're cycling through the hospital system or they're having a fall and they're getting injured. And, I really want to try to find a way, how can we prevent that cycling? Because there is a way to, even with chronic illnesses, to not get injured every 3 to 4 months or to not need the hospital every 6 months. And I've started to explore different ways to go about doing that. And I think getting, beyond just treating the acute episodes and more into that wellness model is really the way we keep people home, aging the way they want to age in the place that they want to age without frequent hospital trips. So that, I could talk on that a lot, but that's one of the main reasons why I've kind of broken, to the model that we're working in right now, because I want to help break that cycle.
Yeah, no, that's fantastic. And I think again, it's there are too many things, especially in that age group, that are a statistic, let's say, right?
Yeah.
Like the volleying through the healthcare system that you just mentioned, falls, which you mentioned is another big one. Maybe you could throw pain from arthritis in there too. Like those are kind of the 3 big categories, I guess we'll say. And some of those statistics aren't necessarily explored. They're just sort of accepted as fact. Like, well, but like a correlation, you get older, these 3 things are just gonna happen to you. It is what it is. And that's not true, because there are ways that we can get in there and change that. So just because the statistic is out there doesn't mean it can't be changed, and improve, decrease, however you're looking at the statistic. And finding a way to, it's a bit of an uphill battle. We're swimming upstream a little bit, because not only are a lot of practitioners in the healthcare system used to that system, so are the people that utilize it, and the people that have been utilizing it the longest are a lot of the people that you're helping. So it's
Mhm.
a lot of sort of changing of ideals and habits around the healthcare system as well, which can be difficult. But I think it's a I think it's a uphill battle worth fighting, because at the end of the
Yeah,
day, people are getting a lot out of it.
absolutely. Yeah, and it is an uphill battle. And I know a lot of things in our medical field may need to change, but we need people to have the passion and the will and the drive and the want to change it.
Mm,
Am I single-handedly going to change it? No. But if we can, change a couple of, our patients, if we can impact our patients and
mm.
change a couple of scenarios, then I think it's worth it for
Yeah,
sure.
yeah, it is, and that there is going to be a trickle down effect from that, because that's one thing I've realized the longer I've gone on in this field is the people that anyone in the healthcare field impacts, if they impact them at the highest level possible within their field, within their ability to
Hmm.
care for those people, that then allows that person to go out and affect people in their lives positively. So we're not just helping the person that's in front of us at the time, or the
Hmm.
people that are on the schedule that day. We're helping them and everyone in their lives by helping them to the best of our ability. And if we're stopping short of 100% and maybe then some, getting them back to better than what their 100% was before, because maybe their 100% wasn't where they wanted to be to begin with,
Yeah.
that impact
Yeah.
is just going to be exponential.
Yeah. That's a great way to put it. Yeah, I totally agree.
Yeah. Well, again, I want to thank you for your extra time here. But before we sort of wrap up a little bit, I have two more questions for you that I ask everybody on the podcast.
Okay.
Again, these are two of the questions that I'm like, I cannot wait to hear Lauren answer these two things.
Oh man.
You're not on the hot seat or anything. There's, I'll give you a hint. There are no right or wrong answers to this.
Okay.
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 So, um, so the first question is, what is your definition of strength?
Oh, my definition of strength. That's a good one. Um, so it's funny. I had a conversation with a patient last week who was really upset that she was having someone else sell a car for her, right?
Mm,
And she's like, I'm a strong, independent woman. I can do it myself. I don't need that person to help me. And I think, my definition of strength when I was talking to her about that is, yeah, but you're a strong, independent woman who knows when it's right to delegate.
nice.
And that is a good situation to delegate because that person's a car salesman and get you a higher value for it. So there's
Mm,
no loss of strength there. So I think, strength, yes, is personal and it's an internal, but I also think strength is knowing when to ask for help and
mm,
knowing when to ask the universe to help you with things, right?
mm.
Because you can be as strong as you want on the inside, but we all need a little help sometimes. So I've
Yeah.
been relying on that a lot as a mom
Mhm.
recently. I'm a very strong willed person and I take care of my kids and I love to do that. But, strength also includes asking for other people. So might
Mm.
be a little bit of off of what you typically get, but I figured you probably get a lot of
No,
empowerment and things like that.
that's a that's amazing. That's yeah. The thing I love about it is, even when answers like this are the same, they're also kind of different at the same time. And this was,
Yeah.
yeah, that was fantastic. No, you're exactly right. And I do love the fact of what you said, that asking for help and accepting it is a sign of strength. Because another thing we
Yes.
see, not just in the group of people that you're passionate about helping, but sort of across the population of people that we help, is a lot of them think they're like whining if they're wanting help with pain, or that they're not able to just like push through, it makes them weak.
Yeah,
But it really is the opposite. It really
it
is the
is.
opposite. Yeah.
It is. Absolutely.
Fantastic. And then the final question I have for you is, what is your true purpose in life?
Oh,
Oh.
oh my goodness. Um, y- so you may not know this about me, but I have a lot of different passions about the planet and less waste and more sustainability and kindness. So I think my true purpose in life is really just to add to the world, not take from it. So raising kind humans, raising humans that don't waste, not
Mm.
wasting myself, feeling grateful for what's in front of me. And then yet whatever I can do, impact with my patients or just the people in my life. I think, my purpose is just to leave it better than when I came into it.
Awesome. That's fantastic. Well, good for you, because I think you're already doing all of that in one form or another. And I'm excited to see where that continues to go for you. So good for you for already living out a big part of your true purpose in life.
Well, thank you.
You're welcome.
Thanks for the
And
compliment.
of course. And thank you for taking a little extra time here and chatting with me and just letting
Oh
people
yeah.
know a little bit more about who you are. And I'm excited to do this as well. And everybody, if you want to learn a little bit more about Lauren, we'll have I'll have a little link in the bio from when we sort of announced that she was a part of our team. That'll give you a little bit more insights. And if you want to ask her questions about anything that she does, anything that she can help you with, we'll make sure that her contact info, direct email is right down in the comments as well. So yeah, Lauren, thank you again so much. This was fantastic.
Thanks for having me. I really enjoyed it.
Of course. Great. Well, everybody out there, go make it a great week, and we'll see you back here next week on the Strength for Your Purpose podcast.